With the Omicron COVID variant surfacing in Shelby County, we are taking action for you.
We know you have new concerns, and we're getting answers to your biggest questions. That's why we've invited infectious disease expert Dr. Steven Threlkeld to join us and answer those questions for you. Good evening, sir.
Hey guys, how are you?
Doing great. Well, now that the Omicron variant has been detected in Shelby County, is it possible that other cases may already be here as well?
I'm afraid it's more than possible. It's quite likely. This thing is taking over. You saw that up at Cornell University, they had to close their campus today during exams. It's gone up about 7-fold in the United States so far. So it appears to be doing very well toe-to-toe with Delta, and I expect we can see more of it in the coming weeks for sure.
Okay, so a new report is suggesting 40% of cases are asymptomatic, no symptoms. How can people protect others if that's the case? I mean, should we be making a habit of just testing regularly?
Yeah, I think that's an important. I think that's a very important point. I think we will find out years from now that as we look back at this, that we did not test nearly enough. We did great with vaccinations, bringing them to market and so forth, but we didn't test enough asymptomatic people or symptomatic people. Know that since the beginning, many people were at least pre-symptomatic. They were spreading this before they knew they were sick. So I think it is a very smart idea if you're dealing in the holidays, for example, with some higher risk people in your group, that you take advantage of testing that's available now to make sure that people are unlikely to give it to other people.
Now, Pfizer said its experimental COVID-19 pill cuts the risk of hospitalization or death by 89%. Do you think this is something everyone should use, or is it just for people who have mild cases of COVID? And if everyone shouldn't use it, who should avoid using this pill?
Yeah, it's very exciting, actually. You're talking about cutting down 90% in the highest risk people of hospitalization and death. This could be certainly a game changer. I think there's a good likelihood that the FDA will only approve it for emergency use initially for those highest risk people. So it may be hard to get for the average risk, though preliminary data showed that it cut 70% risk in people who were just of average risk. There are not a lot of contraindications to this drug. It's a pretty clean drug, even compared to the other Merck product, and it's very effective. So I think it's very exciting. I hope it'll come to approval pretty quickly, and I think it stands a chance to save a lot of lives. It needs to be taken pretty quickly after the onset of symptoms, however. Another point for testing and the availability of that testing so we can get the drug into people.
All right.
Okay, possibly TMI, but I know, I got my first and second were Pfizer, and then my booster, I did Moderna. And, there are these new reports that show mixing different types of COVID vaccines and boosters can better strengthen immunity. Now, what would you suggest for someone considering doing that? And is there a specific mix that is the best recommended mix?
Yeah, well, I'll tell you, I think that it showed that the Moderna vaccine as a booster seemed to have a bit better numbers when chasing after Pfizer, for example, as a boost. It's important to point out, though, that in those tests, they used full dose Moderna, whereas the actual approved booster is only half dose. So that may account for some of that. I think the important way to look at it, though, is that you can mix or you can stay the same. The best vaccine is the one that you take. So like with flu shots, if you have an opportunity to get one, get it. The nice thing is that these mixing data allow us to say that we can have confidence no matter which one that you use. I think that's much more important than any difference you would see in the efficacy between them.
So can you remind us of all the ways we can protect ourselves and our loved ones, please?
Well, obviously, the most important thing I think right now is for everybody to be vaccinated. If you have everybody in your group for the holidays vaccinated, you're going to have your own little version of herd immunity that we can't really approach in the whole population, but we might be able to get closer to it in a smaller group like this. And then also just assess the risk of the people that are going to be there. If you're in a group with a lot of 90-year-olds and 80-year-olds, you need to be more careful about making sure that everybody's vaccinated, or else use testing, maybe masking and some distancing, making sure that your ventilation is okay in that grouping. If you have a group of mostly younger, all vaccinated, boosted people, you can probably enjoy your gathering with little risk really to anybody involved. The chance that somebody's going to have it, give it to others is going to be quite low. But just use common sense about the people you're gathering with and protect those people who are going to be at the greatest risk of getting sick from this.
All right. Incredible information. Thank you so much, Dr. Threlkeld.